Thanks so much for staying with Morning Live. Now, President Cyril Ramaphosa will later today sign the National Health Insurance Bill into law. The bill, which has been long in the making, has been a contentious issue, especially for those who support it and those who oppose it. Professor Alex van den Heever, who's chair in the field of Social Security Systems Administration and Management at the Witwatersrand School of Governance, has refuted claims about the bill, while Business Unity South Africa, for example, has threatened to challenge the bill legally. Now, some have questioned the timing of the signing of this bill 14 days ahead of the country's general elections. Today's three panelists joining us to discuss this virtually are Professor Alex van den Heever, who we also have NEHAWU's Deputy General Secretary, December Mavuso, and Deputy CEO of Business Unity South Africa, Khulekani Mathe. Gentlemen, thanks so much to all of you for joining us here on Morning Live. Prof, let me start with you. With regard to your assertions, as per the presentation, one of the presentations that you've done, you indicate that the NHI will be difficult to implement. Explain to us the complexities you believe facing government in implementing this NHI bill. All right. We seem to have a slight problem there. I can see Prof speaking, but we cannot hear him. So I'll come back to Prof van den Heever in just a moment. But perhaps if we can hear from Mr. Mathe from Business Unity South Africa's perspective, what are your reservations about the NHI bill?
So thanks for the opportunity to clarify our position, Sakina. Just to indicate, firstly, that we support the objective and goal of universal health coverage. We believe that every South African should have access to good quality health care. What we are concerned about is whether this bill in its current form takes us towards that objective. And our view is that it doesn't, because it has certain deficiencies that make it very, very hard to implement. And so one of those is that we believe that to be able to run an effective health system, you really need to have in place the necessary building blocks for that system to run, in terms of having the healthcare workers and so on. Now, you have heard healthcare workers also raising concerns about this, which suggests that we do not really have those building blocks in place. And secondly, that this is a massive undertaking for the country that needs to work, and not just for today, but work for the long term. How the bill is going to be funded, or how the NHI is going to be funded, the sustainability of that funding model is not known. And so again, to go ahead without addressing some of those critical elements, we believe that is the wise thing to do.
Right, let me bring in Mr. Mavuso from NEHAWU. Mr. Mavuso, a lot of questions are being asked about government's intent to proceed with the bill, despite some extensive inputs that have already taken place by a variety of stakeholders at that, including healthcare professionals and, of course, civil society organizations. So what is NEHAWU's view on this? Are we ready as a country?
Thank you, Sakina. Well, as NEHAWU, we think that this is a monumental moment for our society. It's a big transformation measure since 1994 that will see resources redistributed to the majority of our population. The bill has been in the making for some time now. In your introduction, you indicated that there's been debates almost a decade. We know that the Green Paper was put in place in 2011. Since then, there's been debates, a lot of submissions. So it has gone through, a lot of engagement. And to delay the bill when actually the current healthcare system, which is the two-tier system, continues, to discriminate against the majority is not something that we'll support. we understand the concerns that are there. Our view is that NHI will not be implemented at the go. It will take some time. It is our understanding that it will be implemented in phases, and therefore, we can't say that you need to perfect something before you start implementing. So it's a big project. It's a big transformation measure that the country has ever undertaken since 1994. So it is not expected that things will be honky-dory at the go.
Mr. Mavuso, you say you understand some of the concerns. So which are some of the concerns that stand out for you that you believe are valid?
Well, for instance, one of the things we've been raising consistently with government is that the austerity measures that are implemented by government are not helping the healthcare system in our country, because austerity means one thing, it means freezing government spending. Therefore, you're not hiring enough personnel, you're not addressing the issue of infrastructure and maintenance. So we have a high vacancy rate in our public health system. Doctors have been protesting, nurses have been raising concerns. We just celebrated International Nurses Day last Friday. Nurses continues to raise the frustrations they are faced with. Notwithstanding that, but we don't think that we should not proceed, because some of the resources that our government is spending today is, for instance, in terms of the two-tier system, which serves a tiny minority, or tiny population of our country. If we pull together with the rest of the other resources, they will help, in our view, to address some of the challenges, to increase staffing in our institutions, in our hospitals and clinics, to address the issues of infrastructure, better equipment, and so on.
So, Mr. Mathe, let me come back to you regarding those concerns. You also raised the issue of funding and the uncertainty around that. So talk to us a little bit more discursively about that, please.
Thank you. I mean, we agree with NEHAWU that the issues that he raises about personnel and so on are a challenge. It is just not clear that how the proposed bill addresses that. The thing that is often said that, well, you have the two-tier system, and if you merge the resources, then suddenly you have massive amounts of resources. Nobody has said what mechanism are you going to use, for instance, to merge the resource ports that are there. Because in the sort of private healthcare system, these are funded by people, paying into their medical aid. What is going to happen? Are you going to raise taxes and shut down medical aid so that what was contributed to medical aids goes into taxes? All of that hasn't been clarified. And so to create this impression that the bill will suddenly increase the amount of resources available doesn't go far enough. And we think that we're not being totally honest with the population if we make that impression without explaining how it's going to happen. Some numbers that have been thrown around is that you would need an additional 200 billion rand to fund the NHI. If you're going to raise taxes in order to generate the 200 billion rand, it's going to be a significant increase in the tax burden that everybody faces, whether it's that or personal income tax, etc. Have we actually been leveled up with the population to say, yes, we want to implement the NHI, but this is the cost at which it will come? So we just think that rushing in the manner that is being done without doing the basic work, both on the level of getting the population, giving the population information, but also making sure that the building blocks are in place, is unfortunate. And this is what we've raised concerns about.
I believe Professor van den Heever is ready to speak to us now. So, Prof, welcome back. Just looking at the cold, hard facts as it pertains to NHI and its implementation. You did a presentation not so long ago about some of these aspects. Would you mind just giving us an overview? For example, the cost that Mr. Mathe refers to, how workable is this? And also, in terms of the implementation, how complicated might this become for government to do?
Yeah, so firstly, the analysis, one of the analyses that I've done, aside from the costing, was on the general assertions that have been made to motivate for the proposed reform. And the problem is that most of them were found to be, not most, all of them were found to be factually incorrect. The problem with the proposal is that it oversimplifies its options. It assumes that it can just merge private sector spending with the government system. And you can't do that because you've got to increase taxes in order to do that. And the tax bases are already at their limits. So the mere fact that somebody is prepared to contribute to a medical scheme doesn't imply that that money can be switched into a tax. So that's a fundamental flaw in the overall design. And part of the problem is that in none of the technical assessments that are required to review this kind of reform have ever been done. So there has never been a financial appraisal of this proposal. Nobody has basically looked at what exactly can be done and achieved. And if you don't do any financial appraisal, then you don't know whether or not your reform can work. And that financial appraisal is just one part, aside from the massive complications of what the government assumes, or the ANC assumes that it can actually achieve with this national health insurance. It's an immensely complex undertaking. And government is basically very, very fragile at the moment. And there's absolutely no possibility that additional taxes are going to be raised for government. Government is basically squeezed. We've got a massive ratio. And our deficits are increasing, not decreasing, and that's already indicating the limits to what taxes can raise at this point. So there's absolutely no possibility of implementing anything related to this bill, which means that it potentially reduces to a performative exercise instead of an actual real reform that will help people in South Africa. It's just not that.
Which is interesting because it's contrary to what Mr. Mavuso was saying earlier. Mr. Mavuso was saying, well, you don't expect to implement the entire bill at a go. What you will be doing is moving piecemeal, Mr. Mavuso, if I am summarizing what you said correctly. So in that instance, as you see it, Prof, what is it that we can start off on as far as the implementation of NHI is concerned?
Well, what you can start off on is employing a few people at the national level in a national health fund. So you can create posts, and if government makes funds available, then you can employ a few of those people in that office. But that will not be able to do much because they won't be able to purchase any services as additional services. There's no funds for it. Our provincial health services will continue as before because you cannot actually wreck the whole multi-level system of government for financing the NHI fund. So pretty much all you'll have is an office. And it will sit around, perhaps they will set up something to do some centralized procurement of products. But basically nothing substantive is likely to happen. And the big problem is that most of our hospitals in the public sector will continue to be run very poorly at the moment because of poor governance. And the private sector, which has had a major set of investigations for its reform through the health market inquiry, will continue as it is doing now because government has actually failed to implement the recommendations of the health market inquiry. So the problem is actually that nothing will happen other than employing a few people in a national health insurance fund. That will basically be its sole achievement that I can see for the next 5 years.
Mr. Mavuso, your response to that and, the current state of the public healthcare facilities that we do have. Also, listening to our guest this morning and many others who've echoed National Treasury's point that the bill is going to be expensive to implement. So with the state of things as they are economically, also structurally on the ground, Where's the money going to come from?
Thank you, Sakina. Sakina, we strongly believe that through the present government healthcare funding, funds that government spend on tax subsidies for medical aid scheme members, contribution from people who are presently on medical aid, all of that funding would help, the implementation of NHI. In terms of the recommendation of the World Health Organization, in terms of health care spending, it recommends 5%. Currently in South Africa, we're spending 8.5%. So there's a lot of money that is going to, but that funding, the distribution is skewed, as we indicated that the large chunk of that money goes to the 16% of the population. So we think that there's enough resources. But secondly, the minister has provided some updates in terms of, the NHI processes underway, even before the president could sign the bill today, including work they are doing with Treasury, following the announcement by the minister that said some resources will be put in place, including the employment of doctors. I agree with the Prof that one of the things you need to do is to put an office that is going to start the work. But it's our understanding that already in the National Department of Health there is an office that is put in place that is working on establishing institutions that will be key drivers, including appointment of the board, the CEO, and committees of the NHI fund. The issue of the health information system, together with the health patient registration system, are also being, rolled out according to the update that the minister has provided. So we think there's already work that is underway. For us, is to support that work to succeed.
What's NEHAWU's view on the raising of taxes in order to fund the implementation of NHI? Mr. Mavuso?
Well, like I said, the government funds that is used on tax rebates, that money should be redirected to the NHI fund, including the contribution of the people who are members of the medical aid scheme. Government is spending a lot of money on GEMS currently, which is the government employee medical aid scheme. That money will come a long way to ensure that the NHI succeed.
Mr. Mathe, BUSA, like other entities, some political parties who are in opposition, have said that they will consider legal action after President Ramaphosa signs the National Health Insurance Bill into law later today. Are you serious about taking government to court over this?
Let me start, Sakina, just by making a point that actually having established the case that the funding for the NHI is simply not available and it's unaffordable, we don't have to be stuck with either the NHI or the status quo. The private sector has, in the past 10 years, put on the table some suggestions of how we can start to gradually move towards a universal coverage in the form of introducing what is often referred to as low-cost benefit options in the medical scheme system. That, unfortunately, for a period of 10 years has really not been given any consideration, unfortunately. So it is possible to actually move from where we are in terms of the inefficiencies on both sides without necessarily introducing something as big as the NHI with all the flaws that it has. Because we want an NHI that works, if it means going to court to make sure that our views are taken and given consideration, we will do that. But it's not something we take lightly, because actually we want a health system that works, a health system that serves the entire population. It's unfortunate that disregarding the views of key stakeholders may in fact lead to this thing being stuck in courts.
Professor van den Heever, for all intents and purposes, it seems as though this is a fait accompli. So what would you say to the president if he is watching right now regarding signing that bill into law this afternoon?
Well, I'd say he would do better doing his day job, and rather not sort of flight fantasies of this nature as a policy reform. We actually really do need a real cold hard look at our health system. We haven't had any systemic reform for 20 years. And the problem is that this comes across as a veneer. It's a proposal that really can't be implemented, but I'm afraid it comes across as a pretense of a reform. And so I would basically say get on with doing the real work. Where we have an election, and after that, I guess there will be a new government, and there's a question as to how government takes things forward. But we really do need provincial and national governments that take their job seriously. And I'm afraid, and I think one has to be clear here, this is a case where government, and the ANC in particular, hasn't taken their job and their responsibilities and obligations seriously. There hasn't been proper consultation. We're consistent with a proper health reform. We are way off from doing the things that are required to correct the public health system and the private health system. And health systems are complex. You can't just proceed with superficial reforms that can't really be implemented. So I think that the president would do well to reconsider this process going forward. He won't, but then I guess it's up to society to impose its will.
Mr. Mavuso, a final 30 seconds from NEHAWU's perspective.
Well, we think that this is an important milestone as we celebrate 30 years of our democracy. We cannot delay this anymore. Yes, there are challenges, as we indicated, but as a society, we can work together to address those inefficiencies and strengthen our institutions to deliver the quality public service to our people.
Mr. Mathe, final 30 seconds to you.
Just to reaffirm the position that we actually support universal health coverage. The NHI in its current form is not taking us there. We really urge everybody concerned to get back to the drawing board and make sure that we set the right foundations for something that is going to work both now and into the future. What we have currently does not do that.
Well, gentlemen, thank you so much to all of you for your time this morning, helping us better understand and navigate what is to be signed by the President, public signing of the NHI Bill later this afternoon. But thanks so much, Mr. December Mavuso, NEHAWU's Deputy General Secretary. Professor Alex van den Heever is Chair in the field of Social Security Systems Administration and Management Studies at Wits School of Governance. And, of course, Mr. Khulekani Mathe, who's Business Unity South Africa's Deputy CEO, all discussing the NHI Bill that it's expected to be signed into law by President Ramaphosa at the Union Buildings at 2 p.m. today. It's also our question of the day, so let us know your thoughts on this. But right now, 8 o'clock Central African time, here's Leanne with your latest news.